talk. Only when we talk, we'll gain the knowledge. And when we gain the knowledge, we'll be able to go and spread that knowledge to others. So without, obviously, there's a lot of stigma attached to this human papilloma virus infection. That is mainly because the first thing when you Google this HPV virus, you'll see that it is a sexually transmitted disease. So the minute when it's a sexually transmitted disease, generally people think like it is something like a HIV. But let me tell you, it is a virus which is there in the external genitalia of both males and females. It is there. Now, how does it come there? Even the medical, scientifically, nobody is able to prove how does that virus come and stick onto the external genitalia. But it is there. So during sexual intercourse, what happens? One partner passes that virus to the other partner. No wonder the term sexually transmitted. That is because at the time of sexual intercourse, the virus, what is there in the external genitalia of one person, gets transmitted to the other person. Now, this transmission can happen when somebody is having a vaginal intercourse, anal intercourse, oral sex with someone who has the virus. Now, it doesn't have to be a full penetrative sex. Even close skin to skin touching during the foreplay also can allow this virus to be transmitted. Now, again, there are a couple of slides where I'll be repeating again and again. Now, why do I do that? Is because I just need to make sure that you've got the information correctly. So what I want to tell is that human papilloma virus is a very, very common virus. It is there in the external genitalia of both males and females. It is there. And during sexual intercourse, one partner transfers the virus to the other partner, hence the name sexually transmitted infection. Now, most of the time, what we have seen that human papilloma virus causes a lot of issues in women. Yes, like we have heard about it. And now, luckily the Indian government is coming up saying young girls should be vaccinated for this HPV virus. But I want to take this opportunity and educate people saying that men are also at high risk of getting this virus and virus associated diseases. So it is very, very clear that, men are really at risk of developing, and studies have also shown that rates were slightly higher in men than women. So what I'm trying to tell is this virus, it infects both the genders, male and female. Studies have shown that, yes, it infects men. And now studies are coming up and they're saying that oral HPV virus is a growing concern in men. And almost 11 million men have oral human papilloma virus infection in the United States. Unfortunately, we do not have data for the Indian, but as in the US, if you see, more than 11 million of them. So again and again, what I'm trying to tell is in this slide, HPV infects all genders, both males and females. Now, yes, they are saying it is becoming epidemic in men who are having this HPV virus. It could be oral or it could be genital. Now, I have two quick small videos. I really wanted to concentrate and listen to this.
When married father of three, Jason Mendelson, felt a strange lump on his neck a few years ago, he got it checked out right away.
When I got diagnosed with stage 4 HPV-related oral cancer, my life stopped.
Jason has since recovered from his cancer and is determined to raise awareness about the virus.
Let me tell you why I love your mother.
He's gotten his kids vaccinated and wants everyone to know it is preventable.
So this is another important video again where Michael Douglas talks about a HPV virus.
In a world where cancer is almost a daily part of the news, one cancer isn't heard about enough. Oral cancers are increasing in the U.S., and as in my own case, most people know little about them. Like many, I thought that this was a cancer that impacted much older people who had used tobacco most of their lives. While that's still a problem, the fastest growing segment of the people developing oral cancers are young non-smokers. A very common virus, one responsible for the vast majority of cervical cancers, is now identified as the cause of this rapid rise in oral cancers. Thankfully, in a fast, inexpensive, and painless visual and tactile screening, a medical or dental professional can often identify early-stage disease. So please, the next time you visit your dentist or your medical doctor, ask for this simple screening. Finding oral cancer in its earliest stages may save your life.
So it's important, as I said, human papilloma virus causes cancer both in men and women. Now, in women, we know it causes cervical cancer, vulvar, vaginal cancer, and also it causes anal cancer and oral cancer in women. So it causes 5 cancer in women, and it causes penile cancer, anal cancer, and oral cancer in men. So 3 cancers in men and 5 cancers in women. Now, both the videos, what I showed about, they were talking about causing oral cancer. And I told you it's a sexually transmitted disease, and it can happen even with a vaginal intercourse, oral sex, or anal sex. So when generally I talk about, people tend to tell me saying like, that's a Western culture. It's not so common in India. But let me tell you, when we go look back at the Indian temples carvings there, which been there from 885 AD to 1050 AD, you see there is oral sex being carved on those temples. So let's not blame like, it's a Western culture. Let's not point fingers. But what I want you all to understand is that human papilloma virus can be easily transmitted during sexual intercourse from one partner to another. It may be a vaginal penile sex, penile anal sex, penile oral sex, vaginal oral sex, sometimes using a contaminated sex toys. And also what I want to tell is that use of condom will give some kind of protection, but it is not 100% protection. That is mainly because the condom is used just before penetration. So as I told you in my other slide, just during the foreplay, skin to skin contact also can lead to transmission of this virus from one partner to the other. Now, viruses, there are almost like, thousands of viruses, but we generally have about a couple of viruses where we group them as a low risk and a high risk. Now, low risk are the ones which they do not cause cancer, but they cause a small warty, like a small pimple, or I would say a flowery projections kind of a thing that can happen in the mouth. It can happen onto the penis. It can happen in the vagina. Sometimes it can happen in the oral cavity also. So the low risk viruses, they will not cause cancer, but they cause a very irritating warts. So these warts can happen in the mouth, in the external genitalia, and even in the throat. So this is called a low risk virus. Now there is something known as a high risk virus. High risk virus is the one which causes cancer. Now there are quite a few viruses which causes cancer, and for women mainly 16 and 18 are important, because 16 and 18 are the one which causes cervical cancer. Now, again, HPV is a common infection. Every sexually active person is at risk of developing this infection. This means that most of us will end up with at least one HPV infection during our lifetime, and half of these infection could be because of the high risk virus. So remember, high risk virus is the one which causes cancer. Now, let me again repeat. HPV virus causes in women, it causes cervical cancer, vaginal, vulval, rectal cancer, head and neck cancer. But whereas in males, it causes penile cancer, anus, and head and neck cancers. So 5 cancers in women and 3 cancers in men. Now, if you look at the statistics, cervical cancer is one of the common cancer in women. The age range is between 15 to 44 years. And if you see the literature, almost 85% of the cervical cancers are caused because of the HPV virus. Vulval cancer is another growing cancer in women, and almost 30% of these vulval cancers are caused because of the human papilloma virus. Vaginal cancer is again a common cancer in women, and 71% of these cancers are caused because of the human papilloma virus. Now, coming to the anal cancers, as I told you, both men and women are at risk of developing because of this virus. And you look at this graph, surprisingly, men are more at risk of developing anal cancer because of the HPV than the women. And 80% of these cancers are related due to the HPV infection. And again, when you look at the head and neck cancers, for some reason, males are more at risk of developing head and neck cancer than women because of this human papilloma virus. So human papilloma virus, both rectal and head and neck, are more in men because of human papilloma virus than in women. Now, coming to again, yes, studies have shown that 30% of head and neck cancers are caused by the human papilloma virus. So this is again another form of a head and neck, the oral cavity. You can see males are more at risk of developing than the women. Now, these are all the literatures which shows that yes, human papilloma virus is one of the main cause for causing cancer. Now, coming to penile cancer in men, I do not have statistics from India, but yes, from the Western countries, almost 63% of them are caused by the human papilloma virus. Now, I'll take a quick 2 minutes to tell about the cervical cancer, because as I told you, cervical cancer is one of the common cancer in women. Breast cancer is become the first common cancer, and the second one is still the cervical cancer in women. Cervical cancer is easily preventable disease. Now, if you remember Jade Goody, she died at the age of 27. What I want all the women out there to understand is that never ever say that it will not happen to me. Cancer doesn't have any gender bias, it doesn't have any class, it doesn't have any creed. Cancer can happen to anyone, it can happen at any age. So please do not fool yourself and tell no, it will not happen to me, I don't have to go for any checkup or anything. So Jade Goody was just 27 with two beautiful sons, and she died because of cervical cancer. Now, most of the cervical cancers happens between the age of 30s and 40s. As I told you, it can happen in older age group and it can happen in younger age group, though they say it is rare at the age of 25. But these days, we do see that sexual activity is happening at a much younger age when it happens. So, these young girls are at risk of developing cervical cancer early in their life. Now, as I told you, all of us can have this infection in our lifetime. Now, will all of us develop cancer? No, not all of us will develop cancer, but some of them do develop cancer. Now, who are those people? Now, those people who have persistent HPV infection in them. Now, before I go on with this, let me tell you, I told you, yes, HPV virus infects all of us. Sometime in our life, yes, we are going to have. So, does this cause any symptom? We know, like COVID virus, when we got, what are the symptoms we need to look for? But human papilloma virus somehow doesn't cause any symptom. It will not cause any fever, no cold, no cough. It doesn't cause any vaginal itching, no irritation, no penile irritation, no rectal irritation, absolutely no symptoms at all. And at the same time, you really don't have to run to the hospital and get yourself checked whether you have this HPV virus in you or no. Now, why am I saying that is that the virus will stay in the body for some time, and if your immunity is good, the body will fight away this virus and it will shed off from your body. So you really don't have to worry about, you just need to ensure your immunity is good. Now, somebody has started sexual intercourse at a very early age. These are the women who are likely to have virus in them for a long period of time, or somebody is having a multiple sexual partners. So what did I tell you? That yes, virus is there in the external genitalia. During sexual intercourse, one partner transfers the virus to another partner. So after some time, like you change your partner, then what happens? The new partner is going to give you a new virus. So the virus is going to be there in your body for a long period of time. That's when it can cause trouble and cause cervical cancer later in life. Smoking. Obviously, we do know both men and women, when they smoke, their immunity is generally onto the lower side. So when the immunity is onto the lower side, obviously this virus stays in the body for a long period of time. Those young people, if somebody is using birth control pills, be it as a form of a contraception or be it as a form of treating some abnormal bleeding, heavy bleeding, please remember not to take them continuously for more than 5 years. Also, women who are given birth to more than 3 children supposed to have higher risk of developing cervical cancer because of the virus. If there is any history of sexually transmitted disease like HIV, syphilis, generally what happens in these diseases, your immunity comes down. Obviously, the virus it stays in the body for a long period of time. Or somebody's had a liver transplant, kidney transplant, and they are on oral medication where the immunity is on the lower side, the virus stays in the body for a long time, and these are the women who are at risk of developing cervical cancer later in life. Now, primary prevention, how do we prevent cervical cancer in women is stop smoking, or preferably never start smoking. As I told you, there is a strong evidence that when women tend to smoke, this virus tend to stay in the body for a long period of time, and that's when later in life they can develop cervical cancer. Use barrier methods, obviously like condoms during sexual intercourse. And as I told you, it doesn't give 100% protection, but yes, it does give some protection. Something is better than nothing. Postpone sexual activity to older age. Effectively manage sexually transmitted disease. Obviously, if there is like, some syphilis or other kind of STDs, better get it treated, because what happens is like this virus, HPV virus, will act as a piggyback. It sits onto the other virus and it goes into the body and stays there for a long period of time. And another primary prevention, what we can do in addition to all this lifestyle modification, is that sincere request to get yourself vaccinated, which we'll be talking very shortly. So the second prevention for women is that you have to go for regular pap smear test. Pap smear test is a cervical cancer screening test. Now, what is screening? Screening is we do this test in a healthy people. By doing so, we pick up if the virus has created any trouble in the cervix. So, pap smear test, what we recommend is that you generally go for this test 3 years after being sexually active, or between after 25 years. So, sexually active after 3 to 5 years is the first time when you go for your pap smear test. And if you do the latest test, you do it once in 5 years. And please remember, we keep doing this test until we are 65. After 65, or women who had a hysterectomy, if they had regular pap smear done in the past, then we generally say after 65, you really don't have to go for this pap smear test. So let me again tell, in women, cervical cancer is one of the common cancer caused by this human papilloma virus. We can prevent this by change in lifestyle modifications. If somebody is smoking, please stop smoking. Make sure you don't have multiple sexual partners. If you do so, then make sure you use a barrier contraception. And most importantly, get yourself vaccinated. And if you're sexually active, 3 to 5 years after the first sexual intercourse, please go in and get your pap smear test done, and keep doing this until we are 65. Now, coming to vaccine in men and women. So as I told you, yes, human papilloma virus is sexually transmitted during sexual intercourse. So no wonder there is, we can prevent it by a simple vaccine. Now, HPV vaccine is recommended for both men and women. As I told you, HPV infects both men and women. So HPV vaccine is recommended again for both men and women. Now, HPV vaccine, it provides strong protection against new infection. So what do I mean by that is that if you're already been sexually active, that means you already have the virus in your body. So if you take a vaccine, the vaccine is not going to cure the infection which you already have, but it is going to prevent further infection. So that's what I want you to understand. The vaccine will not take care of the virus which you already have, but it will prevent further infection. Now, if a vaccine is taken by a virgin, they're not sexually active yet, and you take the virus, yes, that gives a very good protection from you acquiring a virus. Now, in 2007, Australia became one of the first country to introduce this HPV vaccine scheme for the school-going girls. Luckily, 2006, in that era, I was in Australia doing my fellowship, and I feel so proud today that I was part of that really a breakthrough moment of that country, because Australia is set to eliminate cervical cancer by 2035. So they started vaccinating their young girls in 2007, and 2030 they're thinking about literally eradicating cervical cancer and eradicating human papilloma virus. Now, HPV, this vaccine, as I told you, it is been there in the market from 2007. It is not something new. The new one, yes, is a COVID vaccine. We all know that when COVID vaccine came into the market, we were desperate to get that vaccine. But surprisingly, what people do not understand is that HPV virus can cause cancer in both men and women. There is a vaccine out there and we are still not utilizing it. And today I really want to tell that this vaccine is recommended for both girls and boys. Please do not think it infects only girls, both boys and girls. No wonder this vaccine is recommended for both boys and girls. So as of 2022, 125 countries have included vaccine in the routine vaccination regimen for girls. If you have recently read the paper, India has also approved 5 states to get this HPV vaccine for girls. And almost 47 countries have included boys also in their normal routine vaccination schedule. So yes, studies have shown and proven that HPV vaccine for boys is recommended. Australia, as I told you, it is recommended for boys over 12 years from 2013 onwards they're doing. Now for both boys and girls, what is the age? When do we start giving them is that the best time is before their 15th birthday. So you can start as early as 9 to 14 years. So that is before their 15th birthday. If you give, you just have to give them 2 doses. You give one today, the second dose is going to be 6 months to 12 months apart. After the 15th birthday until they're 26, if you are giving them, then you have to give them 3 doses. So 3 doses, this would be day one. The second dose is 1 to 2 months later. The third one is 6 months from the first dose. So it's very easy to remember before the 15th birthday if they're giving, because that is the best time where these young children can develop very good immunity. So you just need to give them 2 doses. After 15th birthday, you need to give them 3 doses. The recommendation is till 26 because what they believe is that by 26, what happens? People would have got the virus because they're sexually active. After that, once they have multiple virus, they say there may not be huge benefit of getting a vaccine. But the CDC, as of now, it tells that even people between 27 and 45 can get this vaccine. Now, why is that they're telling that they've added the older age group into them, into this is that because, as I told you, if by chance there is some issue and you have divorce or you have you break away from your partner, you have a new partner, obviously that partner can give you the new virus. So the general recommendation is that till 45 you can go between, but 27 to 45 they benefit less because by then the body's been exposed to multiple viruses. If at all you fall in this age group, what we recommend is go sit, have a consultation with your doctor, see do they recommend, would you benefit by taking this vaccine or would you just benefit by going for a routine screening. And how effective is this? HPV vaccine can prevent 92% of HPV related cancers. So I told you in men it causes 3 cancers, women it causes 5 cancers. By taking one vaccine, it prevents almost 92% of the HPV related cancers. Now, who should not get this vaccine? Obviously, if you have any allergy previous, as a child, you have taken some vaccination and you've got some severe allergy, your doctor should know about it. And if you've developed some severe allergy to the HPV vaccine in the past, yes, please tell your doctor. You have any allergy to the yeast because the Gardasil vaccine does contain a yeast component. No wonder people who have allergy to yeast, the doctor should know about it. And obviously pregnant women, are not recommended to take this vaccine when they're pregnant, but after they finish delivery, after about 3 months, that we do say it is safe for even women to take vaccine then. What are the side effects? I'm sure all of us who are listening to this talk have already taken COVID vaccine. Same kind of an effect what you had when you took your COVID vaccine are the side effects what we're going to have. Even with this vaccine, they're generally mild, just some pain at the injection site, swelling, redness, little bit of headache or some tiredness like muscle ache, tiredness are the general side effects what we generally see. Now, what are the vaccines available in the market? We have 3 types of vaccines. Cervarix is the vaccine which gives protection for only 2 types of virus. This is the virus which I told you, it gives protection for only 2 types of the high risk virus which causes cancer. Gardasil gives protection against 4 viruses. 2 are the one which causes cancer and 2 are the ones which causes those tiny genital warts, what I said. So what previously we would recommend saying that is, if somebody is not sexually active, give them Gardasil, because the virus has not entered the body. So by giving Gardasil, it will also prevent the low risk virus which causes those tiny genital warts. The strongly recommended one is the Gardasil 9. Now, if you see, Gardasil 9 covers 9 types of viruses. As I told you, we have lots of viruses which are high risk. So when we have 9 viruses or we have 4 viruses, what happens is it gives cross protection to the other virus. So the higher the number, the good for us, because it will also take care of the other strains. The current recommendation in the US is that to get Gardasil 9. And if you personally ask me, I personally recommend people to get Gardasil 9, because obviously it gives protection to 9 types of high risk viruses which causes cancer. Now, what to note is that please remember HPV vaccination, it provides protection against new infection. It does not cure the infection which you already have. And coming to, yes, how do we prevent this HPV awareness? I think by listening today to my lecture, you are aware that HPV virus infects both men and women. HPV virus causes 5 cancer in women and 3 cancers in men. And there is a vaccine out there which can prevent it. So we are aware, we do have the knowledge now. And we also know that by practicing safe sex, it limits the number of viral infection to your body. Use of proper condom alone has shown to decrease the risk of HPV infection by 70%. It's not 100%, please remember. Yes, but still it does decrease 70%. Limit number of sexual partners. If somebody is smoking, strongly advise not to smoke. So stop smoking, limit your number of sexual partners, get HPV vaccine. And for women, luckily, we do still have a screening test. Unfortunately, for men, we do not have a screening test for the external genitalia. But as you heard, as in the video where Michael Douglas says that next time you go for your dental check or dental clean, just ask your dentist or a physician to just go through your oral cavity once and see are there any abnormal areas. That would be the only screening for both men and women for the oral cavity. But luckily for women, for cervical cancer, we do have a simple screening test, a pap smear test. As recommended, 3 years after being sexually active, go for your pap smear test. Keep doing it until we are 65. Now, these are my social media links, what I have, and that is going to be my number. And if you have, I'm sure if you have any questions, I'll be happy to take it today. But if you're feeling shy that you do not want to ask any question in this open forum, then that would be my number. I would request you to just send me a text. I won't be able to pick up a phone call because, when I'm with the patient, I can't receive calls. So drop in a text, a WhatsApp message, something, I'll surely get back to you. And that's my Instagram handle. I do post sometimes some very interesting things, like if you want to just keep updating yourself, what's happening in the medical field and how we can prevent these simple infections. So these are the 2 things. And now I think we'll have some time for question and answer. I'll be really happy if you can ask me some questions, and that will tell me that you guys have understood what I've spoken today.
Thank you for this very insightful session, Dr. Rani. This was really helpful. I do have a question. So could you shed some light on breast cancer, and what would be some screenings that we can take up?
Breast cancer is one of the common cancer, like, in women. As I told you, breast is the first common, then it's going to be the cervix in women. Now, breast cancer, unfortunately, like HPV related, we do not have any vaccine for breast cancer. The best thing what we recommend is that for all women, irrespective of the age group, every monthly after their periods to do a self breast examination. Now, if you just put in as a self breast examination, we have some beautiful videos out there which will demonstrate how to do it. Only thing what I recommend is that please do it after menstruation. Why is that? Is before menstruation, I'm sure most of the women who are menstruating will understand. Before menstruation, they can feel some tenderness, some pain in the breast. They feel the breast is little kind of like heavy. So they won't be able to do a proper breast examination, because when you do a breast examination, you have to really put pressure on your breast, literally to the pressure that you feel your rib bones. So if you can't put that kind of a pressure, then there's no use of just touching the skin. So to do that kind of an examination, preferably do after menstruation. As I said before, menstruation breasts are tender. So every month, first and foremost, you stand in front of the mirror, look at yourself. Obviously, some people will have two different shapes and sizes of the breast. That is absolutely normal. But if at all you feel something grossly normal, please don't waste your time. Just go to hospital and let the doctor examine you. So self breast examination every month. And if there is no family history of any breast cancer, like mother, sister, what we generally recommend is after the age of 40 to go for a mammogram test. But if there is any family history of breast cancer, say for example, elder sister developed breast cancer at age of 30, then we say yes, 5 years before that, you better start going for your screening test. So unfortunately, there is no vaccine. And whenever there is like cervical cancer, you can pick up some abnormal cells in the cervix even before they can turn into cancer, because those abnormal cells will be there like for like about 10 years or so, then they turn into cancer. But unfortunately for breast, there is nothing of that sort, because when you feel and there's a lump, there's already a lump. But what we generally recommend is that pick up the lump at the earliest by doing a self breast examination once a month and a mammogram after 40 years.
There has also been a lot of discussion going on about men getting breast cancer. So, what are your thoughts on that? Can men get it
Yes,
too?
yes. Men are also at risk of developing breast cancer. So it is just not women, but it is rare. But it is not absolutely that rare. We do see men too having a breast cancer. So the principle is the same. Like, always we generally say you should know your body. Okay, beat any organ, know your body. And if you feel something is not all right, most of the time what we do is that we try some home remedy first. And if that doesn't try, then you try Google remedy. And if that doesn't try, only then you come to hospital. But what I generally tell is that when you know your body, something is not all right, you tried your home remedies, you tried for about 5 6 days, it is still not going down, please just go to hospital and get yourself examined.
Got it. Got it. Thank you so much. Uh, so, folks, if you have any questions, please put it down on the chat here and we'll pick
I
it
mean,
up.
it's a huge topics. Each one can take about a session. So I really didn't want to dilute about everything. We thought let's take one thing, like, understand, digest, and only then you'll have a better knowledge. If I just go on bombarding everybody with so many things, then we'll tend to forget about it. Okay, there's a question if HPV is positive, how can we prevent from developing into cancer? As I said, see, for example, sometimes what happens, women come to us with a pap smear test. And along with pap smear test, we also check if a lady is having a HPV virus. So if HPV virus is there in the body and pap smear test is normal, we generally don't do anything. We don't prescribe any antibiotic, don't do. Bro, please, for heaven's sake, another thing, let me take an opportunity to tell women out there, don't use those vaginal washes, what you see in the market. I don't want to quote any names or anything, but you really see the way they advertise, as if like, those women who do not use it, as if they're really unhygienic or anything. God has created vagina, rectum, oral cavity with some organisms. Those are the healthy organisms and they have to be there. You put some medicated something you buy from the market, you put those chemicals into the vagina, you're washing away those organisms which God intended to have it there, and God put them there. You're washing them and you're inviting trouble. So if somebody tells HPV test is positive, please don't do any of such things. Make sure your body immunity is good. As I said, when your immunity is good, the virus will shed away from your body. Now, next time again, if you go and get yourself checked and the test shows that, again in the pap smear test, it says that virus is been there. So that tells that virus has been there in the body for a long period of time. then obviously we have to look at the cervix under magnifying glass. So, the first time when you get, you really don't have to panic. You don't need any medications, and simple, don't take those washers what are there in the market. Don't put anything into the vagina. You don't even have to spray inside the vagina with water also. No, nothing. Don't do anything. Just improve on building your immunity.
Thank you so much, doctor. I do have a follow-up question to that. So, a lot of folks also suggest that, you like the undergarments, for example, you should not, use any detergent, or you should wash it in a particular way or with particular products. So, like, what would be your thoughts on that?
No. See, normal, day to day, like, if you are putting into washing machine, the normal detergents, it's perfectly fine. Okay. Obviously, not harsh chemicals. Don't, I mean, at least what is there in the market, it is perfectly safe. It's perfectly safe. What we generally tell people is that don't go for bubble bath, like where you put all those salts and all those what shall I say, fragrant oils and these bubble things. There are a lot of chemicals there. So bubble bath, what happens when you sit there, these things can go into the vagina and they can cause trouble for you. So other than that, using the normal detergent, normal into your washing machine, or the normal hand wash, anything is perfectly fine, unless somebody has a vaginal infection. Could be various reason. It could be, we say, candidal infection, or it could be various kind of an infection. Some infections we generally recommend patients don't put it in a common thing, because it can get contaminated. Other things, other people can get contaminated. Use your things in a hot water until the vaginal infection is sorted out. But if your doctor has not advised any of that, absolutely no issues. Use a normal detergent, use it in a normal way.
Okay, doctor. Understood. We do have a few questions that we had received during the time of registration. I'll start putting them out on the chat here.
There's one which says, till what age can you take the vaccine? I told you in the past, in the past we would do advise only till 26. Now the recommendation is till 45. Okay, what are equivalent tests for pap smear test for men? Unfortunately, there are no screening tests for men for the external genitalia. Only test is like when you go in for your annual health check, oral, a physician or a dentist can look at your oral thing. A urologist just request them, saying like, to have a look at the external genitalia, because as I say, if you just go for a general health check, nobody is going to tell, okay, can you pull down your pants? I want to see. Because doctors are also hesitant, because doctors are worried how will that person take the thing. So just kindly request, saying, doctor, I've just heard about it, I read about it. So would you be kind enough to just have a look at the external genitalia also? So that is the only way for men. Unfortunately, we do not have a screening test for penile cancer in men. And should you still be worried as couple if you're yes, monogamous also, even as I said, it may be just one virus which we have transmitted to our partners, but that virus could be the high risk one. We still have to go for a regular screening test. One partner whole of your life, still, yes, the virus can create trouble, so don't ignore. There's HPV infection, non-sexually active people also. Okay, that's very, very, very rare. I mean, textbook obviously teaches that, contaminated, it could be a toilet seat or something. Through that they can, but so far we do not have any evidence that through contaminated toilet seats the HPV can be transmitted, unless like, somebody is examining you, like, when you go to a dentist or something, if they're not using a sterile instruments and the previous person has had a thing, through that transmission, yes. But if not, most of the time it is the skin to skin contact from the external genitalia from where the virus spreads.
Wanted to ask something. I mean, it's more of an observation which our elderly people keep on giving to us, that our lifestyle, our eating habits these days are mostly responsible for a rise in cancer cases. Would really like to know your view on this.
Yes, I would strongly agree with the grandparents, and being a medical in profession, or being an oncologist. Whenever I have a new case, like so many of them, they come and ask me why me. And I've heard people also telling me, like, I don't eat outside. I'm a pure vegetarian. I eat only home cooked food. But still, why? Yes, sometimes there is absolutely no answer. Like, it may not be related to genetic, and why somebody develops cancer, we do not know. But lifestyle modification has greatly impacted. That's mainly because if you see, the first thing I would see, at least in my practice, is that young girls are developing uterine cancer and breast cancer. That's basically because, like, they are on the higher BMI, they're putting on weight. And when somebody puts on weight, in addition to irregular menstrual cycles, they are at risk of developing breast cancer and uterine cancer because of lot of hormone in the body. And obviously, especially the food what we take in, that there is a lot of I would say, adulterated, all these fast foods and all these highly processed foods. They may be easy because what has happened is that now both the partners are working, and we hardly have any time when we go back home to cook. So there's a lot happening even in our medical field, where it says that, if you have a home cooked healthy food, you can prevent a lot of diseases. And it is also very true, you take care of your gut. A healthy gut can prevent lot of chronic diseases, in addition to diabetes, hypertension, cardiac, also malignancies. So it is true what our grandparents say. Yes, pollution is one thing which we can't run away from, because when you're living in cities, there's a hell lot of pollution around us. We can't. But healthy lifestyle, good diet, exercise is one thing which has again shown to prevent not only chronic diseases but also prevent cancers. So we do have to make, I would say, a sincere effort to kind of like dedicate some time and energy to ensure that, at least in whatever best we have around us, we are believe me, when I sit in this chair, when I see cancer patients, I so many times I wish we could prevent it, like, and there are ways of preventing. But again, it is just not me teaching. The opposite person should be willing to kind of like take it, and should be willing to do it. Most of the time when I go for talks, the young generation, they always think that it doesn't happen to me, it won't happen to me, like, that is the age we all went through, and that is the age these young generation are in. And it can happen to anyone. Forget about cancer, we are seeing cardiac diseases, heart attacks in most, at least recent papers, whatever we've seen, are all young men in their 40, the actors, everybody in the 40. So same thing, the cancers are like, previously the doctors would ask, is there any family history of diabetes, hypertension? Now we ask, family history of diabetes, hypertension, cancer. It's become, if you die without cancer, it's a miracle these days. So that kind of pollution and the lifestyle changes that we have put ourselves into, but we can reverse it. It's not reversible. We can reverse it. Where there's a will, there is a way. As we say, health is wealth. Believe me. And I do not want anybody. The reason why I'm so passionate about talks, or passionate about going around telling people to take care of their health, is that I don't want any patients to come to my hospital. Yeah, you want to come and have a chit chat with me, have some coffee, debate about, should we be vegan, should we uh, completely exclude milk products, I'll be very happy, but I don't want any of my patients to come with cancer. Okay,
Thank
so
you
a couple
so
of
much for
questions.
elaborating this answer. Thank you.
So someone
Uh,
has, Pradeep has raised
Ma'am,
his
one
hand.
question.
Pradeep, you can unmute yourself.
Yeah, what you said is 100% right, ma'am. And a small doubt, I got it. You told that 9 to 14 age and 15 to 20. And what about the age of 20 to and 40 or 50, ma'am? What the vaccination is there or not there? We can take it the
Yeah,
vaccine
that
or not, ma'am?
the best is as I told you before, 15 years. Then the next best time is between 15 to 26. Even after 26 years, you can take until you're 45. Okay, But from 27 to 45 years, what happens? There is no huge benefit as the other group has it. But yes, there is a benefit. So you can still take it. But before taking it, just consult your doctor, have a chat with them. Like as I said, like if you're in a single relationship just with a single partner and you do not have any high risk habits or any of that, then I would say like there may not be a really huge benefit of taking that vaccine. Just go for your screening. So till 26 for sure it is recommended. 27 to 45 it is still recommended. As I told you, like sometimes there can be some breakups, like you're looking for a new partner, like some divorce or something. Though those people, yes, I would still say it will recommend. So 27 to 45, I kind of become little choosy who will benefit, who will not benefit. Yes, if they benefit. Now let me also put it at the in a different way. What is the harm of taking? Okay, 27 to 45, what is the harm in you take? I told you there are no major reactions when you take this vaccine. Maximum is just a mild reactions onto the injection site. So when there are no really life-threatening reactions, what we have, even if it can give some benefit, why not take it? I hope I've answered that question, Pradeep.
Yeah,
You
ma'am.
can
Yeah,
take
ma'am.
till 45, but not 50. Till 45 is the recommended.
Ma'am, can you tell me what the
Okay.
price is going? Right, we don't know any basic idea about the prices and everything else, ma'am. Can you
Yes,
please
yes.
mention
The
what
price.
prices are going?
Okay, let me tell you. Let me ask you one question, Pradeep. If you want to buy a new phone, what will you look at? You look at the price, or would you look at what best model you can get and what is the best features that phone has? Uh, so anyway, let me
No,
let me
not like
tell you
that. It's a
about the
basic
price
question.
also. No, I know. I'm just kind of like trying to tell that yes, we should be aware of the price, but please don't make the price as one of the main criteria for not taking it. I told you there are two Gardasil. That is the one which I personally recommend. The old Gardasil, which was covering only 4 viruses, the MRP of that is 3,927. But the latest one, which covers the 9 viruses, that is Gardasil 9, the MRP of that is 1,850. So obviously, if we are, getting vaccinated our children, I always tell parents, this is the best gift you can give your child. The best gift. I mean, yes, the best first gift I would say is a good education, and the second one is good nutrition to them, and the third one I would say like even before any phones or any vacations or anything comes into the list, the best thing you can give your child is getting this HPV vaccine. So even if you see before 15 years, if you have to get 2 doses, that is going to be about 20,000. After 15 you have to get, it is going to be 3 doses. On an average, it is going to be about 30,000. But imagine you're preventing cancers. I mean, that is, I wouldn't compare, I wouldn't get worried at all about the cost factor. But I'm sure, like, if companies come together, the companies can negotiate with the vaccine guys, and I'm sure the cost can come down. Okay, there's a question. Do hormones present in milk, chicken, etc. have correlation to cancer? Oh, yes. Yes, yes, yes. I mean, I wouldn't say directly, like, uh, what is the percentage? Like how I said, HPV causes this percentage of cancer in men and women. I will not say, but surely we do have. I mean, we have seen, including use of plastic bottles, like single-use plastic bottles or anything. Those are the micro hormonal content. What they are there are all these have shown. Yes, they can contribute in causing cancer.
One more question, ma'am.
Please go ahead, Pradeep.
Ma'am, you told that that's the age of 9 to 14 is a girls also. You told me that. What about the kid? Means what about the
Girls and
kids, man? Like
girls,
boy.
girls and boys both are the same.
Okay, okay, ma'am.
What I recommend in my practice is 11 to 14 years is the best, because 9 is like they may still have some vaccines and all those things to happen, finish of all that. 11 to 14 is the best for both girls and boys.
There was one more question. So someone had asked to explain about prostate antigen test and digital rectal exam.
Okay, now that is going to be very difficult to explain that. Now, prostate antigen test is generally what they do in an older age group. Like, it's a kind of like a blood test to see if somebody is at risk of developing a prostate cancer. Now, digital rectal examination is where a doctor puts in a finger into the rectum to feel if there is anything. Now, who should get it and when they should get it? It is totally, I would say, different from person to person. So I wouldn't generally recommend to talk it like saying like yes, older age group, like when you go for a health check and all this, prostate antigen is there in the blood group. And digital rectal examination, the doctor decides when to do, if at all there is an indication for the doctor to do it or no.
I think that's all the questions we have. If anyone has any last minute questions, please put it on the chat. Meanwhile, also wanted to point out here that if you folks are looking for any screenings or vaccinations to be done, you can reach out to us, and we will help you with that. I will quickly put down the number to where to reach out to, and you can reach out to that number, and we will take it from there. We can end it here if we don't have any further questions.
I don't think there are any more questions. Thank you so much, doctor. It was a very, very informative session.